I am a victim of the 2016 CDC opioid guidelines to reduce forced taper chronic pain patients off their opioid medication. I'm also organizer coordinator of the Don't Punish Pain rally in Metro Detroit. I would like to share my story on many abuses and ups and downs I've been through. When I was about 13 years old, I started to experience a lot of pelvic pain and abdominal pain. And, doctors thought it was just growing pains or, puberty, gonna be starting a period. Just never thought anything of it. When I turned 14 years old, I ended up in the emergency room because the pain was horrific. Doctors gave me Tylenol, discharged me, said it's just period cramps. She's gonna have to take something for periods like Midol or ibuprofen or Pamprin. So I've tried that. It worked a little bit, but not much. I started to get worse, around 16 to 18 years old. My father was diagnosed with stage 3 esophageal cancer back in 2011 on my birthday of September 27th. He had a really lengthy cancer and went through surgery on May 5th, 2011. From May 5th to 2011 to September 6th, 2011, he had a failed botched surgery. There was a lot of leaks, sepsis, pneumonia, and he was on life support for 5 months and ended up dying at the hospital. So he never got to see me graduate, which I never did yet. I was a victim of relentless bullying at Franklin High School in Livonia, Michigan. I couldn't go back to school because of that. And then also on top of it, my father passed away on my senior year. And then chronic pain, so there's like 3 factors why I couldn't go back. So from ages 18 to 21, I went through the ER literally 3 times a week. The pain was unbearable. I went to specialists after pain management, after OBs, everything. Nobody would take me seriously because you're too young, you're too fat. And the thing was, my fatness, yes, I am a little overweight. I will say that. I have struggled with an eating disorder since I was a young teen. I was teased and bullied, told I was fat, and nobody wants me. So I started restricting myself. I had some anorexia, but the most was binge eating and bulimia, binging and purging. So when doctors say that would just spiral back to my eating disorder. I have this really big stomach. It's bloated. And it looks like about 9 months pregnant, and I am not pregnant and never been sexually active. So doctors would dismiss it saying it's fat, you need to go exercise, quit drug seeking. So when I used to go they used to treat my pain, but they were tired of me of coming in. I was a frequent flyer, and I didn't want to go. My doctors would tell me, you need to get admitted, but they would never admit me, the ER doctors. That was up to them. So back in 2018, we'll just get to here. I went to gastroenterologists. They outruled IBS or Crohn's, don't have that. I kept saying, it's not my stomach. Well, it's still in the abdomen, but it's in my pelvis. I know I have endo. I had a feeling I had endo. My first laparoscopy was back in 2015, and they didn't find anything, which is really weird. And then in 2017, I had this doctor who was a complete quack. He was a Arabic doctor who operated on me at the Beaumont Dearborn Hospital. And he said there was nothing wrong with me, that I was a drug addict. And then he literally left the country and did not follow up with me for my surgery, which I shit you not. It was horrible. I went into a deep depression. I really thought, what if I am a drug addict? What if I am a drug seeker? But when they gave me pain medication, it gave me a quality of life back. I could clean my room. I could find a job. I could do school. I just couldn't function without pain medication. And when I tell people that, they're like, oh, you're addicted, blah, blah, blah. But the thing is, addiction means you want to get high, right? You love the feeling of getting high. You love it. You want to sell your drugs for higher medication. Me, never felt high off my meds. The only side effects I got was a little bit of constipation. But with the help of eating good fiber foods, that helped. And then also a little bit of sleepiness. But once I started taking it, daily, the sleepiness went away and I could just live my life. Never felt high. So dependency is you're dependent on it. Like how a diabetic patient is dependent on their insulin, right? And same thing goes with people that are depressed. They're on antidepressants. They have to depend on that so they don't kill themselves because they have depression to handle the suicidal thoughts. And same thing goes with bipolar. It's okay to take it. We need to end the stigma on opioids. It's not a bad word. Even narcotics. I used to cringe when they said, "Oh, you're gonna take a narcotic or no narcotics." Narcotics literally reminds me of like a stigmatized word, like how you call someone the R word. I'm not gonna say it. It kind of reminds me of that because it's very stigmatized. It's very awful sounding. That's just my opinion, but I'm not comparing it to the R word because the R word is very derogatory towards people that are mentally disabled. Same thing goes with like LGBTQ, the F word, the F slur, which I'm not going to say. So in 2018 of November or October, I think, I went on the internet to find a new OB. I was tired. I didn't want to do it anymore. But God was telling me, you need to find a doctor, Journey. Come on. Oh, by the way, my name was Carol, and I started to change it around September, October, because of a long story with being bullied and being abused my whole life. I want to change my name to Journey because I'm on a journey. So my name is Journey, or J, for short. So I made an appointment on ZocDoc, and I really recommend ZocDoc to anyone. No spawn here, but ZocDoc really helped me. So you would look up what you want, like what kind of doctor, maybe an endo or a gastrologist doctor, PCP, OB. Sorry, I got a stomach ache. So I searched for, I need an OB, and then put your insurance, which I have Medicare, Medicaid. I am disabled. I'm fully disabled, and I will get into my other diagnosis a little bit. So I met this doctor. I'm not going to name her name because I don't want her being exploited on here, but I will call her like a Dr. Blue. We'll just call her Dr. Blue. Dr. Blue is an OBGYN doctor, and when I first came to her, I couldn't believe how kind she was. Just thinking about it right now, talking about it right now, just makes me cry because I had my whole life, doctors didn't care about me. They would just say, you're a drug seeker, get out, you just want to get high, your pain isn't real, you're just fat, you need to exercise. And she literally thoroughly examined me. I had to take off my clothes. I showed her my belly, and she says to me, I know you have endometriosis, but I can't diagnose it until we have our laparoscopy, which is another surgery like how they did before when they didn't find anything. And I told her, well, they didn't find anything. She's like, well, they probably didn't search it right because you have to go through everything. She said, so we have to wait 3 months. You have to take birth control because your insurance wants you to take birth control first, and then the laparoscopy the next year. So it was around November I saw her. So I cannot take birth controls or progesterone because I have mental illness. I have a history of suicidal thoughts, depression, and mania, so I can't take it. So 3 or 4 months passed. My surgery was in April of 2019. I was very nervous. I was very scared. So it was at Huron Sinai Grace, which sadly where my dad passed away, but thankfully it wasn't where he was. There was like a floor for specific people on ventilators, but this wasn't it. This was a surgical room. So this is how dedicated this doctor is. Dr. Blue came in, and she wasn't going to come in because her mother just passed away, but the funeral wasn't going to be in like 2 days. And she said, I'm sorry, I cannot give up on your surgery. I'm coming to, because I'm so sick of you being in pain and I feel so bad for you. That's how dedicated she was. Her mother just died. She recently had a hip injury, and she said, I'm going to keep doing it because I know you have endo. So she explained to me that the surgery would only be an hour or an hour and a half most. As I was under, I found out I was under for 4 hours. I'm not kidding. It was only going to be an hour or hour and a half surgery, and it turned out to be a 4-hour surgery plus recovery time. So it took me about an hour and a half to wake up from the anesthesia. I was in a lot of pain because they cut me a couple places. Thankfully, they treated my pain because a lot of the opioid crisis now, you will only get Tylenol or Motrin after post-op pain. Thankfully, they gave me Dilaudid and Zofran to get through it because I get really sick off pain meds. So it really helped. And then she gave me prescription outpatient to take, to heal, and that's it. So she comes in with my mom and says, "Holy shit, you have one of the worst cases of endometriosis I've ever seen in my practice." And this is her exact words, I swear to God. She said, "I don't understand why these doctors from before did not see it. I didn't even know where to start. I had to burn off 75% of your endometrial tissue, which wrapped around your fallopian tubes, your bladder, your colon, and your kidneys. And there's other organs too, I can't think of it, and large intestine. It wrapped, but thankfully she burned 75% off, so a lot of it's mostly in my rectum still. So it's a pain when I go have a bowel movement." So after that, I started going to her for pain management. She wanted me to go to a pain doctor, but the problem is a lot of pain doctors won't accept you if you're already on pain medication. So I told her, "How about this? I will, go to a physical therapist, a pelvic physical therapist that they prescribe me to go to, and a chiropractor." She said, "If you do those two, I don't mind prescribing your medication," because she doesn't want to get in trouble, which I do not want her to, because CVS already gives her a hard time. So she said I was diagnosed with stage 4 endometriosis, and I'm still not out of the woods. Alright, next thing is, a couple of years ago I had a bad hip injury. Back in 2017, I was living at this old ghetto apartment called Orchards of Newburgh in Westland, Michigan. Not ashamed to say what it was, because they need to be known that their place is horrible, ghetto, rude, and it was very unsafe. I was throwing trash away one day, and it was in the winter, and it was very slippery. There was black ice, and the complex failed to salt it. So I didn't see the black ice. I'm sorry, I have an itch. I didn't see the black ice. So as I was throwing a big garbage away, tossed it over the big bin, my ankle gave out, my right ankle gave out, and I slid, and I fell this way on my right hip on concrete, and it sounded like this. Like that. It was really bad. It was the most painful fall I've ever had. I am a fall risk, but this was the worst because it was not only concrete, but it was black ice, which is really slippery, and it makes you fall faster. Thankfully, I did not break anything because my bones are good. God bless. However, my hip was never the same after. When I would walk, my hip would click. When I sit down, it lock up. When I stand up, it lock up. So my mom recommended me to go to my PCP to see if I can get an MRI just to make sure there's no maybe mini fracture or anything. Even though I could walk, and there was no broken bone. It was swollen, but it wasn't broken. If it was broken, you couldn't get up. But I could get up. It took me a while because I already have a lot of arthritic pain and fibromyalgia, so that didn't help. So my ex-boyfriend, which is an asshole, which I'm not going to tell who, my ex-boyfriend a couple years ago offered to drive me to my MRI appointment at the local hospital that was prescribed by my PCP outpatient, and it wasn't too bad. I hate MRIs because they're crazy and creepy, but it was just like a half MRI because it was just going to do my right hip. And then they did my left hip too because it took me a year to get an MRI, by the way, and it spread to my left hip too. So when I had my MRI, it was like about 15-20 minutes, wasn't too bad. I did take something to relax me because I have really bad claustrophobia and anxiety. I'm diagnosed with a panic disorder, since I was like 14, Anyways, after that, they said, "We'll give you your results. You go back to your PCP, he'll go over your results." So I went to my PCP, and he's horrible. I'm trying to find a new one. He doesn't understand endo. He thinks it's fake. But however, the only time he was right, he said, "Okay, you do not have a fracture. You do not have any broken bones. However, you have a pretty severe case of arthritis bursitis on both hips. That's why it's clicking, and that's why it's stiff. So there's pretty much nothing we can do but give you PT." So I did go to like a aqua therapy PT for about a couple weeks, but my insurance didn't cover it, so I had to quit. Fast forward, my hands. So this pinky hurt one day. It looked like I sprained it. I thought I sprained it. Then it started getting progressively worse. So I wanted to get it checked out at my doctor's. And I said, hey, I said, why does my pinky hurt? It feels like it's sprained, but it's not. He said, well, it might be carpal tunnel or maybe a tendonitis. Do you type a lot? I'm like, yeah, because I was working at the time. I worked at Michigan Works in Wayne, which was an unemployment agency. And that was one of the best jobs of my life. Hold on, let me crack my neck. Oh, I have a lot of neck issues too. That's fibro. So anyway, after a year passed, probably of November of 2018, the same amount of time where I saw that OB, both hands started hurting and it's swollen. It swolled and then also was red and it was warm to the touch. And my mom was freaking out because my mom's side of the family has a history of rheumatoid arthritis. So I thought, I'm too young for that. I shouldn't be having that. So I did get a blood work test back in 2018. They said it was negative. So that was 2018. Well, recently, I just had a blood test because I had to go to the emergency room about a month ago. I passed out in my bathroom. A warning, this is kind of gross. I passed out in the bathroom in the puddle of my own vomit. I was throwing up so bad that I hit my head and I passed out and I had vomit everywhere. I was in a lot of pain in my pelvis. Come to find out, I had a really large ovarian cyst that was about to burst. And thankfully, the hospital I went to treated me with dignity for once. They gave me some pain meds. They gave me nausea meds. They also gave me some fluids because I was dehydrated. And they did an ultrasound, pelvic ultrasound, and showed me what happened. So the reason why I'm bringing that up is when I was at the doctor, it was really weird. They brought up my blood work from my PCP that he did 2 months ago. Get this. This is how shady my PCP is. Trying to find a new one. So my PCP 2 months ago, it's going to be, no, actually 4 months now, or 3 months. 3 or 4 months, bear with me. 3 or 4 months ago, I went to my PCP to get a checkup of my blood. It's been 2 years. I want to check if I have RA. I told him my hands are getting worse. He kept dismissing me, saying RA doesn't affect the hands, which is bullshit, because I have a lot of friends that have RA. And so he's like, well, we'll give you a blood test. I'll check for all the diseases, like RA, MS, all that. Which I figure I don't have MS because, I know a lot of people are really bad off, like their feet curl up. I mean, I know I have stiffness in my toes, but not when it curls up or my hands curling up. They do get stiff. So he checked my blood, and he said the results won't be back in a month, which is kind of stupid because, what he did was he'd draw blood of all the patients, and he would wait at the end of the month until he's done with everyone. So you have to wait, and it's annoying. I didn't get my results back in like 2 or 3 months. When I ended up in the ER that night, they went over my test, and they wrote on my discharge papers. I didn't know this. They wrote, diagnosed with rheumatoid arthritis, has an ovarian cyst on her left ovary. It was a size of 2 sunflower seeds. It was pretty big. It seems small, but it's not. It's very big for a woman, And thankfully, I had a nice doctor. She held my hand. She said, well, we'll get you feeling better. We're going to do some tests. We'll give you pain relief. We're not barbaric. And, she wasn't. She was really nice. So I told Dr. Brazil what happened. And she was... Oh, wait, I said her name. Oh, well. Dr. Blue... I said her name. It's all right. That's a different doctor. But Dr. Blue was really concerned. She thought my cyst was solid, which means that it would have to be removed. I would have to have my left ovary removed. That's if it doesn't disintegrate, because if it doesn't disintegrate, it'll grow bigger and bigger, almost like a tumor, like not a cancer, but benign tumor, and it'll have ovarian torsion where it'll flip it, from the weight, So she got back with me. She said the hospital said is not a solid one. It is I forget the name of it, but it was a dissolving one, so it'll go away eventually. It'll take a couple days. You relax, take your pills, lay down, heating pad, everything. So that is my journey. And I also wanted to mention that at the time when I wasn't prescribed any medication for my pain, I had a wonderful friend when I used to be vegan, from the vegan community. She messages me one day and she says, her name, I'm just going to call her Liz. Liz says, hey, Journey, you are in a lot of pain, I heard, and I know your doctors keep force tapering you because of the opioid crisis, because I was force tapered. I was cut off cold turkey, And I did go through a withdrawal. Like anyone goes through a withdrawal if you get cut off cold turkey. It doesn't mean you're an addict. An addict is if you want to get high. Like, oh, I want to get high. But I was in pain. I was going through withdrawal because you don't take someone off like that. Same thing. I just got off of Prozac about 3 months ago. I'm still not the same. So that proves my point that any type of medicine you're on, you'll get sick. You'll go through a withdrawal. So anyway, my friend Liz said, hey, have you tried Kratom? I'm like, Kratom? What's Kratom? She said it's a South Asia plant. Sorry, I'm not really educated about it, but I know she said it comes in a powder or capsule form. It's like green tea. It's part of the coffee tea family. She said it's safe. She said there is propaganda against it saying it's unsafe to take. There's been deaths, but the only thing about that is the deaths were caused by heroin in the people's system, not the Kratom. She said I can give you a good vendor, and so I started ordering Kratom, and she said go with the red strains. So the red strains are good for at night to help you relax, sedate you a little bit, kind of make you sleepy. I said to God, where was this my whole life? Why didn't I know about this before? I could have taken this before when I went all through this bullshit. And it was just a miracle. The first dose in the morning, because she also told me to take green too. So green in the morning because it keeps you going. It's like you drink a cup of coffee. And then red at night to go to sleep. So I took the green in the morning, didn't take the red yet. I took the green in the morning, and I got out of bed. I started making my bed. I started cleaning my room. I was cleaning the whole house. I did a run around the block. I couldn't believe it. And it wasn't like a manic, like, oh, no, it was like, I want to do this, I want to clean up my room, and I couldn't believe no pain for like 2 hours, and then it came back. And then you can dose it every 2 or 3 hours, depending on your pain. And I'm pro Kratom. I am. I'm pro Kratom because of the opioid crisis. Not only pain patients have been stripped, but I have nothing against addicts. I want to say this right now. Drug addicts deserve help. The only thing I don't like about drug addicts is when they say we should ban opioids because I don't want to abuse them again. Which is very heartbreaking because your words saying that is very hurtful. So because you don't want to mess up on your recovery, you want us to pay the punishment. That's not fair. You deserve treatment. You deserve respect and dignity. I know many hospitals treat drug addicts like shit. I know. I have a friend that is recovering. But I just want to let them know is just because, you have a history of addiction doesn't mean all of us do. Statistics, scientists, and Dr. Klein from Twitter, he's an MD from Raleigh, North Carolina. He's the biggest pain advocate. He said less than 1% of chronic pain or acute pain patients abuse their medication, 1% or less. That is low. That shows you we are not addicts. We are in pain. And let me answer some of the myths here. Hey, I had surgery and they put me on Percocet and I got addicted. No, honey. That's not addiction. How I ask people about that, because they're very uneducated with dependency and addiction, I say, so you say you're addicted on Percocet. Did you feel high off of it? Well, no. Okay, did you sell your drugs to anyone? No. Have you complied to doctor's orders by giving them a urinalysis and blood tests and everything? Yeah, I do. But I think I'm addicted to it because I take it all the time. And I say to her, that's not addiction. That's dependency. Yeah, you're dependent on it. It's going to be hard to get off because any drug, if you take it for a long time, it will be hard to get off. Like I said, Prozac's worse than opioid withdrawal to me. I'm sorry. Someone said they compared Prozac getting off of meth. Someone literally told me that. I don't know if it's true. I don't want to undermine people that got off meth, but I know meth is very hard to get off because I know someone that was recovering. But anyway, I told her, I said, that is dependency. You're not addicted. You think you're addicted because of the stigma saying, oh, if you take opioids for a long time, you'll become addicted. And people need to learn. Same thing goes with benzodiazepines. You're not addicted unless you love the high, you sell your drugs, you doctor hospital shop, and I'm not saying know a specific drug because when I used to go to ER, they asked me what worked for me and I told them. And doesn't necessarily, but they're talking about if you have other drugs in your system. That's not addiction, honey. That's dependency. So it's okay. We need to stop the pill shaming. Just like how people say we should stop shaming diabetic patients that take insulin, or heart patients for taking heart medicine, or depressed people for taking antidepressant. Why shame opioids? Because it's scary? It really isn't. Opioids are actually safe if used correctly. Correct use is not abuse. Correct use is not abuse. That's only if you like to get high. And that's when Dr. Klein from North Carolina also said that the addict gene affects people who have addiction running in their family. So that could be another cause why you got addicted after surgery. Let's say if you like to get high or something, because your side of the family, or going way back, you have an addiction problem. Like I said, drug addicts deserve respect, equality, and dignity. They deserve to get the help they need. And another thing I do not like is doctors prescribing Suboxone to chronic pain patients. That is something for drug addicts to help them recover. Chronic pain patients should not be lumped in the same category as addiction. And like I said, no shade to addicts. They have their own form of treatment, while chronic pain patients have their other form of treatment. So Suboxone is just as addictive, because I want to tell you a quick story, because I'm going to be logging off soon. I know I've been talking about my story, but I really want to talk about it. There was a lady, 7 years ago, I tried to commit suicide. I missed my dad so much. Everyone was telling me to get over him. I had no friends, no family that supported me. So I decided to take my life by jumping off the roof of my tall house. And thankfully the police got me down, but the police literally threw me against the ground when I didn't even have a weapon, which pissed me off, but they did save me. So as I was in the psychiatric ward for about 5 or 6 days, I met this lady. I'm not going to say her name. I'm just going to make up another name. We'll call her Linda. There was a lady named Linda who was taking Percocets because she had 3 or 4 failed back surgery, 7 screws in her back, sciatica, and then I think CRPS or RSD, one of the two. And she was in pain, and Percocet helped her, But since you are in the psychiatric ward, they will take you off anything that's a controlled substance, like Xanax, Ativan, Valium, Percocet, hydrocodone, or anything, or fentanyl patches. They'll take you off of it. And so they put her on Suboxone. She was so sick from it. She says Suboxone makes you high, and she hates feeling high. She didn't like it. She started to see purple figures down the hall, and she ducked because someone threw a bowling ball at her in her hallucination. So I said, why are you giving this older lady, 75-year-old lady, Linda, Suboxone when she's not an addict? She is a chronic pain patient that Percocet saved her life. She said Suboxone gave her one of the worst pain ever. And another lie from Dr. Andrew Kolodny. Dr. Andrew Kolodny is an addiction psychiatrist specialist who is severely against chronic pain patients. He told us he hopes we all die. You can Google that. There's a lawsuit. I'm also going to be posting a GoFundMe that says Pain Patients Fight Back. We are raising $100,000 to get lawyers to sue all these doctors, medical professionals, the government for messing up our lives because of the guidelines that came out in 2016. So Suboxone, like I said, is for drug addicts for their treatment. Opioids should be used for chronic pain patients. If everything else fails, it shouldn't be like, oh, let's put you on it right away. Try things first, but if it doesn't work, it's okay to take them. So I just wanted to say thank you for listening to my story. I am a coordinator, organizer of the Don't Punish Pain rally in Metro Detroit. We just had our first rally October 7th, 2020 at the Garden City Hospital in Garden City, Michigan. We had about 8 protesters that came, and they were sharing their story, how they've been denied pain medication. This girl got into a wicked car accident that ended up almost killing her and paralyzed from the waist down. And she has been denied pain medication. Now she's bedbound. Thankfully, she found kratom. Also, for people that will probably bring up in the comments, what about marijuana? I am 420 friendly. I am pro marijuana. But the thing is, some strains do not help others. I have tried marijuana. It does help the cramps a little bit, but I don't like feeling high. I get very paranoid. I do have mental health issues. I feel like it makes it worse, but I'm not saying marijuana kills you or anything or is unsafe, but I recommend people who have mental health issues just to watch what strain you use. I've tried sativa, indica hybrid, sativa hybrid. I didn't like the way I felt. I don't like feeling high at all. So that shows you right here I'm not a drug addict. So anyway, thank you. If you are a chronic pain patient that's been suffering and feeling like giving up, please don't. I will fight for you. Many pain patients around the world. And also, please follow Claudia Mirandi. She is a wonderful person. She is the founder of the Don't Punish Pain rally. She was on Dr. Drew. Dr. Drew cut her off on a phone call. And Dr. Drew, after the phone call ended, he forgot to turn his mic off on the radio. And millions of pain patients heard him say, chronic pain patients are borderline druggies, which is appalling. We are in pain. We're not criminals. We're not addicts. Same thing goes with addicts. They're not criminals. They need help. But we should not be lumped in the same category. We are in pain. We didn't choose to live this life. So if you have a doctor that's not listening to you, I suggest you to go on the Don't Punish Pain rally site, which will also be in the description. And there are many leaflets and flyers you can pass out to educate your doctors and pain clinics. One more thing I want to say, I know I keep saying one more thing. One more thing I would like to say is pain clinics are scams, some of them. I'm not saying all of them, some of them. There was a person on Twitter, I'm not going to name who, she said that she has to drive 100 miles to a pain clinic, the only one that will prescribe her pain meds, because she has CRPS. Complex regional pain syndrome. That is the suicide disease. She has to drive 100 miles out to give a urinalysis, and sometimes doctors will purposely false read your urinalysis, a pee sample. So let's say you come in, never did marijuana. They also check for kratom too, so I tell people to be careful. Alkaloids. Let's say they check all of that, and then also say, hey, you have cocaine in your system. We can't prescribe you anymore. You're a drug addict. The thing is, it's false. Because why is it in your system when you've never done it? It's a way for doctors to cut you off because they don't want to get in trouble by the government. Seems like it's a conspiracy, but it's not. This is very real. This is the pain genocide. Also, pain clinics. Let's say I was going to a pain clinic and I was at work. I'm still looking for a job right now, but let's say I was at work. They can call me up and say, hey, we need you to come down to the pain clinic right now to do a pill count. But I'm at work. Okay, well, if you're at work, then we won't refill your pain meds. They blackmail you. It was horrible, I did see a pain doctor before in the past, and all they did was prescribe me a TENS unit and Lyrica, which I gained so much weight, and I had brain zaps. I didn't like it. So right now I am on Zofran for sickling vomiting syndrome as well due to the endometriosis. I take hydrocodone as needed, kratom as needed, and I take Klonopin for my panic attack. And another thing is, pharmacies are fearful to prescribe to like a benzo and a narcotic at both times. They're afraid that we're gonna mix it, which we won't. I'm afraid of drug interactions. You should see me all the time calling up on the phone. Hey, is my Lamictal safe to take with a Zofran? And they'll say, yeah. I always make sure. If I do, let's say if I took a pain medication at night, and I wanted to take my Klonopin to go to bed, I wait about 2 to 4 hours window to make it safe. So pharmacists are also being attacked by the CDC guidelines and the FDA and stuff and DEA. But the thing about pharmacy is we give them a script. They're supposed to fill it, not judge us, fill it and leave. Why are they withholding legit pain scripts? I could see if someone came in oh, I need some Norcos. Well, do you have a script? No, can you just give me some? Then that's a way different story. But when people come in with a legit script from their doctor and they're in pain, you see them in a wheelchair or a walker, and you have the audacity to say, I'm not feeling this, I'm not comfortable filling opioids, then you should find a different job because you are taking someone's life away. Cancer patients have been denied. It's horrible. Hospice patients are being denied before they die because doctors are worried about them getting addicted. This is serious. This is a pain war. This is not war against opioids. It's war against pain patients. This is a pain genocide. They want the sick to die. They want the disabled to die. They think we're useless. But in the reality is when we do take these pills, we have a quality of life. We are a functioning member of a society. We can get jobs. We can babysit our kids. We can just do stuff with our family. And then you take away our medicine, and then we're going to die, shut down. And pain does kill. Doctors at the ER would tell me pain does not kill. It's just discomfort. Then say it to many people that have died of strokes, cardiac arrests, heart attacks, and other symptoms that cause them to die. This is real, guys. Wake up. I'm talking to the doctors, government, medical professionals. Wake up. This is a genocide. This is like how Hitler used to kill all the Jewish people because they were weak or they were useless. That's how we feel. I'm not comparing the Holocaust to this. I'm just saying they are acting just like us, getting rid of us because we're useless, because we're in pain. When I worked, I used to take my pills, go to work, and I did a great job. I got an award from work because I did such a great job. Dear government, quit taking our lives away. Quit taking our pain medication away. And quit with this. Let us. Sorry, I'm so angry. Quit telling us what to take. We have tried Tylenol. On the bottle it says, good for aches and pains, minor aches and pains. Ibuprofen, I'm allergic to NSAIDs. I bruise, I rash, I have black stools. A lot of people have that, but I can take Tylenol, but it doesn't work. It's okay to take opioids if they help. That is our last resort, especially veterans. I'm sick and disgusted with veterans, the VA hospitals denying pain management for veterans who came back from the war, fought for us, their limbs were blown off, and they suffer with PTSD or brain injury, and that's how you're going to treat them? Veterans are the first priority to get help, and that's how you treat them. They fought for our war. You fought for our country because of war. Wake up. Smell the coffee. This is a genocide. We will not stop talking, screaming, shouting about this pain rally. Please join your local movement at www.don'tpunishpainrally.com. Link will be in the description and the GoFundMe. Please join us. This could be you one day. It could be your family member one day. They're one accident away. Let's say you got into an accident. They will not give you anything for pain. One accident away. One injury away. Please help us out and be with us. Be our ally. That's all we want. God bless and stay strong to my fellow Spoonie, chronic pain warriors. We will get through this, I promise. I'm not going to stop fighting till the day I die because this is atrocity. Thank you.